A gunman opened fire on CDC's headquarters, and my guest had left the campus just 30 minutes before. Listen to hear how that moment broke her silence, why the public health workforce needs community now more than ever, and what she's doing to channel her passion into advocacy across the globe. You're listening to the PHEC podcast, episode 455. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners, as well as the broader communities that they serve. The support we provide often falls in the category of strategic planning and sometimes capacity building, just depends upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. I'm very excited to introduce you to my guest for this episode. She is an infectious disease physician and former CDC epidemiologist whose career took her from disease detective work to refugee health before a pivotal decision changed everything. In this episode, she shares what it was like inside CDC as the political landscape shifted, why humanizing the public health workforce matters so much right now, and how she found a way to turn grief and anger into meaningful action. She also opens up about the importance of community, self-care, and staying anchored to your North Star, even when the road feels crushing. Dr. Elizabeth Soda is an infectious disease doctor who ultimately resigned from the Centers for Disease Control and Prevention, the CDC, in the U.S. in late 2025. She represents a growing number of individuals who continue to leave CDC, several hundred already in 2026 alone, which is clearly a threat to the public health workforce. Now based in northern Italy, she continues to advocate for strong, evidence-based public health systems through her work with the National Public Health Coalition. We'll connect my conversation with Dr. Soda right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Well, I'm excited for all of you to meet my guests on this episode. We've been chatting for quite a while, and I said I need to finally hit record so that we can capture this. Dr. Elizabeth Soda, welcome to the podcast. How are you?
Thank you so much. I'm doing well, and I really appreciate you having me on, Dr. Huntley.
Oh, my pleasure, my pleasure. And we have so much to dive into. I have millions of questions. And like I said, we were chatting a bit, but I'm excited to really get to know you and have the audience along as well for this journey and this conversation, which I know is going to be just filled with insights. Let's start with you just introducing yourself. Tell everyone a little bit about who you are and what you do.
Yeah, thank you. So I trained as an infectious disease doctor, and I took care of patients for several years in the clinic, hospitals, those sorts of things. And then I was fortunate enough to get accepted into CDC's Epidemic Intelligence Service, or EIS, in 2016. And, for listeners who may not know much about EIS, the program is really meant to take people like me and turn them into disease detectives, which just really means, right? They give us real world problems. We use data and science to try to help solve these public health problems. After I finished EIS, I was so fortunate that I could stay on at the agency, had so many different cool roles while I was there. I spent a lot of time working on superbugs, so the antimicrobial resistant organisms, like how do we stop their spread? I did that both in the US and abroad. Got to do a lot of outbreak work. So everything from, Legionella in hospital water cooling towers to COVID-19 in our nursing homes to Ebola in Uganda. And most recently, I was working in immigrant and refugee health, but I ultimately decided to resign from CDC in September 2025.
So at the time of this recording, this is early 2026. So it hasn't been that long in the context.
That's not.
Yeah.
That's
Yeah.
right. That's still pretty new.
Yeah. We're going to talk more about that, but I would love to go back a little bit first. I'd love to learn a little bit about the journey to where you are now, and then I'd love to hear more about your situation and kind of your decision for leaving and kind of what you're doing. When did you first learn about public health or think about public health as a career? It's one of my favorite questions.
I was such a slow learner. Like, for a very long time, I had no idea what public health was. I'm gonna be like straight up honest with you, right? I was just going to be that doctor taking care of patients. And, like as a doctor, you're aware, right, that there are reportable diseases, but I wasn't even sure who did the reporting and like necessarily what happened, right? That was my baseline. After I finished my training, I ended up in a job in a hospital where I took care of patients, but I also was their medical director for their hospital epidemiology program. And, I got to do all the stuff, monitoring antibiotic use and trying to figure out why surgical site infections were happening. And it was also during the big West Africa Ebola outbreak. And, there was still a lot of concern about potential importation. There was a lot of panic, I think, within our hospital. So I got to do a lot with preparedness and like thinking about this from a public health perspective. And that's where I fell in love. So I applied to EIS, was fortunate to get in, and that's sort of where my public health story started.
Wow. Well, I will tell you from my own personal experience and from interviewing so many people on this podcast, a lot of us kind of fall into public health because I didn't know what it was. And we start the medical school route because that's what we know. At some point, we discover public health. That's why I'm so excited about the programs that introduce public health so much earlier. Like
100%.
the fact that it's an undergraduate degree program option now, which didn't exist when I was in school. And so many people are being introduced to it earlier, like high school level, and have a chance to take courses. So I think it's wonderful. I want to see the elementary school kids being introduced to public health and understanding what it is. But I guess that's another campaign. That's a really fascinating story. So you were able to, when you stayed at CDC after completing the EIS program. So most people, let's not count the chaos of 2025, right? Or that CDC has always been on the top one or two things that people think of when they get a degree in public health. I want to work for CDC, or I'm going to go into academia, or I guess government, state government, or just what people really thought. In fact, for years of this podcast, that's where people really thought that was the only place you could work. So I spent time trying to let them know, like, there's so many different options. So I would imagine that when you completed the EIS program and you landed a really good position with CDC, did you think that that was going to be where you would stay? Was that your sort of dream spot?
I thought that was going to be a forever job.
Yeah.
Right. And the cool thing about CDC as well is that there's so many different disciplines within it. Right. And I do tend to like variety and diversity. And it's been really cool that, I had this chance, right, to experience so many different aspects of public health and absolutely loved it. So yes, I always dreamed, right, this was going to be my forever job. I was very mid-career and the election had gone differently. I would still be there, to be completely honest.
CDC is what we all in public health understand to be like the ultimate. It's our nation's health. I mean, I worked in state government and in the public health laboratory. So we reported, and specifically in virology, I remember we sent our flu isolates to CDC. Everyone reported from our counties and regions in the state up to the state level, and then we would submit those. We did surveillance for a number of diseases on the state level, and our training, we were sent to CDC for training, and so that was just the ultimate respected authority. I never imagined that what happened in 2025 happened. So please share with me, how did you get to September and your decision in September 2025?
It was a hard one. To be honest, soon after the election, I figured I would start rethinking the whole thing and actually had started applying for jobs in state and local health departments. I hit a point in early spring, though, that I felt like I could still do more good by staying with CDC. And that potentially meant like being able to better advocate,
Mhm.
right, for public health. It meant doing my job well and trying to raise flags when I saw them. But, inevitably, I think that there's only so much within your control. I feel very passionate about refugee populations. They were the group that I was working with. And starting to see some of the political pressure that was happening, right? For people who may not be aware, the US sort of sets a limit of how many refugees can come into the country at any time. Soon after Trump took office, he shut down basically all refugee movements. And come to find out a couple months later that the only refugees we were going to be allowing in the country were white Afrikaners. And that just really did not sit well for me. It just wasn't something that I could support. And it really sort of beginning of the end, knowing that they pass no judgment on anybody and their decisions. I just want to make that very clear. But for me, it was just an example of I cared about this population so deeply, the refugee populations, that is, and to see that I could no longer work and support them the way I wanted to, it just really meant it was time. And I think that that was all then sort of capped by the shooting in August. I'm sure many people are aware, but in August, a gunman who was driven by anti-vaccine rhetoric, opened fire onto CDC's headquarters. Hundreds and hundreds of rounds, and ultimately a police officer lost his life over it. I had left the campus about 30 minutes before the shooting had started, but had never felt such an immense sense of horror and dread and just the realization, right, of what was happening and never believing, right, that I would ever see that day. That's kind of when I really broke my silence, to be honest. I had been very trying to follow by the rules. And at that point, though, I started talking to press and really becoming more open in my advocacy, right? Because at that point, when you have someone coming out and threatening now the lives of our public health workers, right, I couldn't afford to stay silent. So I think it's all of those rationales finally what led me to decide to resign in September.
I remember clearly when that happened. What are some things that, I mean, you're freely able to speak your mind. I am not wanting you to say anything that you're uncomfortable with sharing, but I'm going to leave the question a little open. But I would like to know, what are some of the things that maybe people aren't aware of that happens, or maybe even happened during that period of anywhere in 2025 or just general? Like, what could you say about what's going on that maybe we're not aware of? Because we're only picking up what we hear from media.
Now, what you're hearing, I mean, I guess one I guess I really want to express is just sort of it's hard to encapsulate the feeling that was CDC before January and like the feeling that is CDC now, right? And I think you have to sort of like have been there and been in those buildings to feel it, right? But you kind of went from this extremely joyous, collaborative, people are really excited and passionate about their jobs, right? To an environment where there is just now such low morale. We had all those people illegally fired, right? We have people resigning like me, right? And it seems like almost every day there's something new coming out, whether that's the removal of ACIP members or a total changing of the childhood vaccine schedules, right? It's really hard to explain how different the agency feels. That to me is a huge problem, right? To me, that is a public health emergency, right? When our workforce is under such threat, I don't know how we keep Americans safe.
Yeah, yeah. That's exactly, I guess a lot of us are thinking and feeling that way. I've been on campus there maybe 2 or 3 times. It's interesting, I was invited to speak on a panel. It was a career panel, and students there were a group of scholars, and they won the opportunity to, like, present their research at CDC, and they spent a couple of days there, and then there was this career panel. The majority of people on the panel were from different parts of CDC, because that's most of them had questions
Mhm.
about, well, how do they get a job at CDC? I was brought in because there's a lot of interest in consulting. So people wanted to know what about consulting. And I was invited to speak on that panel. But I just remember there were maybe 300 students, two or 300 students there, and all the questions and all the interest and all the people that spoke on the panel from CDC in different areas, still that goal. I mean, of course, this was a few years ago, and still that bright-eyed
Mhm.
thinking of one day I want to work at CDC. And the people there with all of their years of experience, talking about what they do in their area. And there was just this confidence and this sense of this is what we do. And then there's the museum when you come into the main campus and
Mhm. Amazing, right? Amazing.
walking through, and I think when I spoke, it had been maybe 10 years before that I was there, so it was just it's
Mhm.
that iconic opportunity in the position, and I just can't imagine it being anything different, but I know it's very different now.
And the people themselves are the same,
Right,
right?
right,
The people that's why when we try to reiterating, right? The career scientists there still care so much about what they're doing, but it's been this over politicalization, right, that has taken over the agency and this rhetoric that is just it's just making it so hard. And that is very morale busting, right? When you care, you are literally the same person you were,
right.
but now can't do your job.
That is one of the reasons why I'm so passionate about the series that we keep hosting on the podcast. What is public health? I truly believe that when the community, broader community, really understands public health, if we as individual public health professionals are able to share with our friends and family through the lens of which we work. So, if, as an epidemiologist, infectious disease specifically, you can start to explain to them public health and share those stories on that community plain level. I mean, plain language
Yeah.
conversation with the community where they're understanding public health because, we've always said when public health is working well, it's silent in the background, which is fine and it's
Exactly.
true. But we have to sell that. The community needs to be aware because that makes us harder to erase. We never imagined what happened in 2025 would ever be a situation we would be dealing with. We
Uh,
knew that things were going to be rough with this when Trump won the election. We knew that, but we never imagined what we experienced in
never.
2025.
Never. And you're really right. I survived Trump won,
Right.
right? And so I'm aware this was gonna be different, but the speed at which it happened and the things that were being implemented just caught me by surprise.
We have to get that community buy-in because we are we're very as public health folks, we're used to being in the background and behind the scenes. We're very giving, caring people because we're very consumed with the public. Even those that reject us, we're still trying to advocate for their health because that's who we are as public health
Right.
professionals. So
Right.
we're getting beaten up really, like we're beat up by this, but getting that community buy-in is to me a huge it's not the only thing to do and it's not the solution. But from where I stand, I feel like it's something that can have a really big impact rather quickly,
I agree with you. I totally agree with you.
especially in this election. It's a very important election year. We get more buy-in, this is just a really important thing to do. But back to you. But I think really you reminded me of that, the why behind me really wanting to advocate for the series. How are you advocating? Like, I know you're very involved in some really important moves, but like, how did you, let's kind of go back to you made the decision, you left, and then what happened next? Like, what do you do with that energy because I'm sure there's a lot involved with that kind of a decision.
Yeah, there is, and honestly, the energy sort of even started before I left, right? I mean, honestly, the anger I have a lot of anger
Yeah.
that I need some way to channel that positively, right? And so for me, doing something really helps me, right? It helps me make sense and helps me feel like I'm doing something. And it may be small somethings, but there's something. I've been really fortunate to have such an amazing community of like-minded folks. Public health community is amazing. They have amazing people, just such lovely, lovely people. And I've really gotten involved with the National Public Health Coalition, or NPHC. NPHC is a grassroots organization that was actually formed by some feds that were fired illegally last year. And again, they took their anger and frustration and did something good. And their mission is really simple, which is right to continue to educate, right? Educate the public about public health, advocate for public health, and show people, right, what public health is a vital government service. And so, with them and other folks that I've met along the way, we've done things like, I helped shepherd in two congressional letters that we sent to Congress, one of which had over 1,000 signatures from Health and Human Services staff telling Congress about all of the problems that we're having with RFK and actually asking for his resignation. Clearly, that has not yet worked. But again, like these were things that we did that I think people could feel ownership of, felt like they were doing something, it mattered. I actually got to go to the Hill with NPHC, and actually it was a crazy experience for me, right? Like that's not ever been my world, right? But to go in and meet with staffers and talk about CDC, talk about our workforce, that's been really awesome. And honestly, in some ways I've become a little bit of a talking head because I did lead, right? I want to be very clear that I never want to say that I'm speaking on behalf of anyone at the agency or any, former or current. We all have our own different opinions, but I have the privilege and the freedom to be able to speak now freely about public health and about the workforce. I take every opportunity. I appreciate you having me on, to come on and continue to raise awareness, right, about what's happening to the workforce and what's happening to CDC. And I love what you said. I do feel so passionate about trying to humanize the public health workforce, not only public health, but the federal workforce and state and government, to be honest, right? We are all sort of this like nameless, faceless entity, right? Where we do our jobs well, and we don't feel like we need a ton of credit for it or any of those things. And I think in some ways that invisibility is really kind of where it's kind of led to where we've gotten, right? It allows them to control a narrative without sort of a counter narrative to it. So yeah, trying to be vocal about these things is how I'm channeling my anger.
Yeah, same. That's exactly. And I think for me, it's helping me have a way to do some good in this moment.
Right.
And did you participate in the rally for public health in DC?
I did not make it out to that one. No.
Abby Tai, who actually started,
Who was executive director of National. That's right.
yeah, she was on the podcast a little while back, and I'll make sure I link to that episode. And she talked about Fired but Fighting, which is how the group who were illegally fired by this administration from CDC, they started the coalition. They changed the name. And she's also been a panelist. She spoke on one of the episodes of What is Public Health, and she updated us to say, the change to National Public Health Coalition. But yeah, they were at that rally for public health. She was there, and there were a few other people there, and that was a very powerful experience to stand up for. It was the first ever rally for public health on the National Mall, and it was kind of scary because this is not exactly a great time to be protesting. It's our right to do so, but we've seen what happens when people participate in very peaceful protests. It's not the people rallying, it's the people around that can cause the problem, but we didn't know what to expect. But at any rate, it was a very powerful experience to participate in that, and we were calling for the resignation of that leader that should not be there. And we will continue to advocate for people's health. I mean, we have to continue to do the work. And I'm not passing judgment on anybody of where they stand in this, but I just find that if you can find a way to do something that you can channel that energy, there's so many ways that it all comes together. Like all those streams flow into like this river, and we become a lot stronger, if we can do that.
So like, that's a good way. Yeah, it's a great way.
Like, I just don't like the alternative of just letting it bottle up and destroying, my own health. And we all know what that will do. So I have to find a way to channel it. And I really encourage people.
Yeah, community. We need community more than ever. Right. Now, we need our communities more than ever. I think that there's never been a bright spot. I now have an amazing community of people, like people I would never have met. Right. I mean, never. Like we don't work in the same things. We wouldn't have been in the same buildings. I mean, I've built community with people who are in different agencies than I am. Right. That's amazing. Right. And it's going to be our communities that ultimately get us past this. Right.
Yeah, this is inspiring, this conversation. It's really inspiring me. And I'm hoping that it's kind of rising up. Some people are feeling something rising up in them as well. Tell me a little bit about kind of where you are now.
Yeah. So I physically am actually no longer in the United States. I'm actually currently living in Italy. My husband now has a position here. So I moved here with him and my family. I'm kind of free agent right now. That's how I describe myself. I'm doing a little bit of public health consulting and then, doing all my advocacy work. And, I think it's just trying to process all of it, right? I have to say it has been nice to sort of been out of it and having time to be introspective about all of it, I don't think I even fully realized how poorly I was doing, like, while I was there, right? It's taking time to sort of figure that out. And I think on a personal level, there's a lot of to be honest, there's a lot of guilt, right? Still, like, the guilt that I abandoned my position, I've left my country, just sort of trying to, like, navigate that. And then, I think there's a lot of privilege and joy that I have now, but there's also grief, right? There's sort of grief for my life took a very major detour. Didn't expect it to happen, but it is what it is. But, we're trying to figure out what's next. And
You said something that I really want to touch on because I hear this. I've experienced it myself, and I hear this from a few people. But you say you didn't realize how poorly you were doing or how much of a weight it took was taking on you until you were removed from the situation. And we know
Mhm.
that to be the case. And that's where I think about all of our colleagues who are still in positions that are really taking a toll. And I admire them for remaining in those positions and continuing to do that work.
100%.
My big call is we really have to take better care of ourselves because we just have to, for whatever level of stress we're feeling, we have to just know that it's much stronger and there's much more to it than what we're already experiencing. And we just have to find ways to really, self care, people get tired of hearing the phrase and the term, and we will dismiss it to some degree, but we really have to take better care of ourselves because in the long run, we have to, if we're choosing to continue to do this work, we have to take care of ourselves, put our own life vest on before we can help someone with theirs. How are you doing that? Because I know that that's I'm going to put you on the spot there, but I will tell you first, I'll put myself out there. I say this publicly and I do it on purpose because I really want people to ask me, kind of the rule follower, so I want people to ask me about it when you see me in public. Or one of the things I've done, I've started jogging. So for years, my exercise of choice has been walking, right? And I've been consistent with walking. And I thought I had bad knees. I mean, I was told I had bad knees a long time ago, and I just embraced that. And that was my reason for not running. But I had a whole checkup, and doctors like, actually, there's no reason why you can't run. If you start to have problems, then you just go back to walking. So I started jogging last year. I'm a
Nice.
super slow jogger, and I'm not gonna, I don't have any plans of like a marathon or anything. But I started jogging and I started this training program. And anyway, I find that it is so rewarding. And I think that that level of that energy spend, like going the level up, is helping with the stress that I'm already carrying in my body, if that makes sense.
Always that.
So I've been doing that and really enjoying it. So I've been consistent. Like it took me a while to actually start after saying it, but throughout the end of last year and into this year, it's become the thing that I find that it's helping. My blood pressure is down just a little bit on average across
That's
the board.
great.
I'm a diabetic and it's been well managed for years. So I find that even those numbers, A1C, are dropping just a little bit. So over 6 months, I'm seeing my own numbers, comparing myself to myself. But it's the thing that I decided, like, I'm just going to do this to help me in this very stressful time. I'm trying to, so, and feel free, everybody listening, feel free to ask me about it when you see me to hold me accountable.
And I have tried to pick up running, jogging, jogging so many times because I know it and I do it and I do. I feel so much better afterwards. But I just come to I am not a runner. Like there is something like genetically in me that I am not a runner. But I totally appreciate it when people can embrace that and have it make them feel so much
Yeah.
so worse for them.
I've met people who, so my clients actually, who picked up there's a partner, one likes knitting and the other one does like cross stitch. So during a meeting, like we can be meeting and they'll say, I'm sorry if I'm looking down, but like they decided that's what they do during their meetings. That's how they're taking care of themselves. There's all these different things. We've got millions of ideas. So even like in our community, we have like a little space for wellness. And I do that so people can like share what they're doing. And we're often still, as public health professionals, all of us, we're still thinking and we're trying to put out fires and we're still doing that work and we're not taking care of ourselves.
For sure, right? And I mean, really, this started even in COVID. I mean, all the stress and everything that came with that. And then very soon afterwards, right now, we're
Yeah.
facing this other massive crisis. right? So there's just been very little relief, I think, for the public health community as a whole. And like you said, right, you just got to find a way to try to cope and make that a priority. But again, everyone in public health put everyone else above themselves, right? So it's really difficult.
Yeah. I'll keep reminding folks every chance I get, but we're not wired that way. We need we're going to need to be guided there. And that's okay. But that's how I'm trying to look out for everybody. Like that's because we're looking out for everybody else. We're like, we have to look out for ourselves as well. So
100%. Just say living in Italy definitely helps with some of that. Like they have a beautiful cafe.
Yeah.
So now I walk my son home from school and we stop and get gelato and just sit and chit chat. Right.
That's wonderful.
But I think that's something that you can replicate, right? Even in the United States.
That's true. Yeah, that's really nice. Any chance to just absorb, your environment, be outside, pause, slow down a little bit, take a walk, as opposed to jumping in the car or jumping on the bus or something like that. And you can. Yeah. Good reminders. I'm enjoying our conversation and I've gone way off on a lot of things and that's okay. But as we wrap up, I want to ask one final question. Thinking about our audience who may be feeling all the things that we've talked about, like, is there one bit of advice that you could share with our audience as we begin to wrap up?
Yeah, I guess, particularly if there are any public health students out there listening, it's not so much advice, but really more like my thanks to them. And, I know right now the road is very hard and it feels sometimes very crushing, right? But I think we all know nothing ever lasts forever. There will be a day, right, when we will rebuild and we'll really need this next generation, right, of public health leaders to come up and help us lead. And so it's not really advice, but more just like a thank you. And, please stick with it and please stand by what you believe in, right? Like find what is your North Star and stick by it. I think knowing what you believe in and what you want to support in this career is really important because the work we do is so critical. So, just a big thanks to anyone out there right now.
Yeah, I love that. Thank you for so much wisdom and kind thoughts and words and encouraging words on this episode. I really appreciate you for taking time and joining me on this episode.
You doing this. I love the fact that you're asking these questions, right? It's so important. And I really appreciate you doing this. So fantastic.
Awesome. I really hope you enjoyed that conversation as much as we did. This conversation is a powerful reminder that public health has always been a people-centered profession. And right now, those people need to be seen. When invisible becomes invisible enough to silence, advocacy becomes a form of protection. Finding community, channeling frustration into action, and taking care of yourself are what sustains this work for the long haul. Whatever your role or career stage, your presence in this field matters. Stick with it. I encourage you to connect with the National Public Health Coalition and learn more about the great work that they are doing. You can find the links to connect on the show notes page. Now, the show notes page for this episode, which is episode 455, can be found at phecpodcast.com. Once you're there, just navigate to episode 455 to find the show notes. One more thing before we go. Remember that our podcast has an app and a private community independent of social media platforms where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download our PHEC Podcast Community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.